Calcium. We often think of it as the mineral that keeps our bones strong and our teeth healthy. But did you know that calcium is also very important for your heart, muscles, and nervous system to work properly? Our body needs just the right amount, not too little and not too much. The normal level of calcium in our blood is about 8.5 to 10.5 milligrams per deciliter. When calcium levels rise above 10.5 mg per deciliter, that's called hypercalcemia. In this video, we'll explore what hypercalcemia is and what it causes, what symptoms, how it's diagnosed, and what nurses can do to help patients stay safe. Hypercalcemia refers to the presence of excessive calcium levels in the bloodstream. Calcium affects numerous aspects of the body, including muscles, nerves, bones, and the heart. Excessive calcium can lead to the body's equilibrium being disrupted. Consider calcium as an employee who plays a crucial role in maintaining a smooth functioning of the organization. When the number of employees working at the organization increases, the likelihood of chaos also increases, similar to what occurs during hypercalcemia. Calcium levels in the body are regulated by three main components: the parathyroid glands, bones, and kidneys, with vitamin D playing a supportive role. The parathyroid glands, located behind the thyroid, secrete parathyroid hormone or PTH. Increases blood calcium levels by releasing calcium from bones, aiding the kidneys in retaining calcium and activating vitamin D to enhance calcium absorption from food. Hyperparathyroidism occurs when the parathyroid glands are overactive, resulting in excessive PTH release. This condition leads to an increased amount of calcium being released from bones into bloodstream. Other common causes of excessive calcium levels or hypocalcemia include cancer that spreads to the bones, excessive intake of vitamin D or calcium supplements. Certain medications such as thiazide diuretics and prolonged immobility, which causes bones to release calcium due to lack of use. Too much calcium in the blood affects almost every system in the body. A helpful way to remember the symptoms is this phrase: stones, bones, groans, thrones, and psychiatric overtones. So let's break that down. Stones. Because of kidney stones, the kidneys try to remove the excess calcium, but this can lead to stones and dehydration. Bones. Bone pain and fractures can occur because calcium is leaving the bones. Groans. Abdominal pain, nausea, constipation, and loss of appetite, all due to slowed down muscles in the digestive system. Thrones. Frequent urination as the kidneys try to flush out the extra calcium. Psychiatric overtones, meaning mental changes like confusion, fatigue, anxiety, and even depression. In severe cases, patients may also have irregular heartbeats, muscle weakness, or even comatose. To confirm hypercalcemia, doctors will request several tests. The main one is a serum calcium test. If it's higher than 10.5 mg per deciliter, that confirms hypercalcemia. Then, they check PTH levels to find the cause. If PTH is high, the problem is likely the parathyroid glands. If PTH is low, the cause may be cancer, vitamin D problems, or medications. Other tests include kidney function tests, vitamin D levels, and an ECG to check the heart. On ECG, hypercalcemia often shows a shortened QT interval, which tells us the heart's electrical rhythm is speeding up. Treatment depends on how high the calcium level is and what's causing it. For mild hypercalcemia, the patient might just need to drink more water and avoid calcium-rich foods and supplements. But for moderate to severe cases, treatment is more active. The main goals are to lower calcium levels and treat the underlying cause. Here's what may be done. IV normal saline 0.9% sodium chloride to help flush out calcium through the kidneys. After rehydration, loop diuretics like furosemide may be given to remove extra calcium, but never before giving fluids. biphosphonates or calcitonin to stop calcium from being released from bones. In very severe cases, dialysis may be needed to remove calcium directly from the blood. As nurses, our roles include monitoring intake and output, watching for cardiac changes on ECG, assessing for muscle weakness or confusion, encouraging mobility to prevent more bone calcium release, and providing education like limiting calcium supplements and staying hydrated. Let's wrap it up. Hypercalcemia is when blood calcium levels go above 10.5 mg per deciliter. The main causes are overactive parathyroid glands, malignancy, too much vitamin D, drugs, or immobility. Remember the symptoms: stones, bones, groans, thrones, and psychiatric overtones. Diagnosis is done through calcium, PTH, and ECG tests. Management focuses on hydration, loop diuretics, calcitonin, and biphosphonates, plus nursing monitoring. So the next time you hear about a patient with hypercalcemia, think of balance. Keeping calcium levels just right helps the body run smoothly. So that's it for hypercalcemia, the condition of too much calcium in the blood. Thanks for watching. Stay balanced, stay curious, and keep learning.